Hello everyone, this is Dr. Janine Cross, and this video is a review of evaluation, termination, and follow-up in social work practice, in generalist social work practice. What is evaluation? Evaluation is when the plan has been completed with a client and has been executed based on the planning process, and the goals have been met. The goals are reviewed prior with the social work and client. So the client is aware of the goals, the objectives, and the goals of service intervention based on the contracting process at the start of services. We then go backwards and evaluate whether the plan or the contract that was set in place at the start of services was actually completed. And so, in order to do that, the social worker and the client must then review the original objectives and goals and then compare the outcomes with whether the goals have been met. If change or progress has not been made, the client and the social worker will go back and review the goals and objectives and make modifications and changes if needed, or have a discussion on what are the factors involved to why the goals and objectives have not been met. Um, Oftentimes, there needs to be modification of the goals if there has been changes either with the client, with the agency, with the worker between the time that the contract was developed to the point where you are evaluating the process or the outcome. But either way, the evaluation is important. Social workers should always evaluate how the client is doing throughout the process of work of the working relationship. In generalist practice, we talk about assessment and client assessment and what it looks like. Even though the assessment occurs at the start of service, assessment is an ongoing process. You're constantly assessing the needs of the client throughout the process of the relationship, the therapeutic relationship, because those needs can change as things change in your work with the client. And so that's why it's important that you're also engaging in an ongoing evaluation process um, throughout your work with the client to determine how the client is doing and your ability to meet the client's needs and the agency's ability to meet the client's needs. What is evaluation? Evaluation determines the effectiveness of change efforts or interventions. So you're constantly trying to determine if you are being effective as a social worker with the client, but also are the interventions that you put in place working with that client. You want evidence that the outcomes or the goals, evidence if they have been achieved or not. You're also testing theories, methods, and perspectives in the evaluation process. Maybe you're applying cognitive behavioral theory in your work with clients. Maybe you're utilizing attachment theory with your work with clients. How well is that theory predicting the outcomes for your client? You're also evaluating the methods. Perhaps you're working with an agency that has specific methods that they're using to improve client outcomes. For instance, you could be working in a child welfare agency and they use motivational interviewing as an evidence-based method. Is that working with clients? Is it motivating clients um, to meet their goals? Um, a method may be cognitive behavioral therapy or psychoanalysis. How well are those methods working to improve client outcomes and goals? And you're also evaluating your perspective. What perspective are you using in your work with clients? Strength-based perspective, perhaps? And again, you're oftentimes throughout the course of work with clients evaluating um, a multitude of things. And again, theories, method, and perspectives are other things that you're evaluating as well. Quality of the services being received by the client is being evaluated. Your agency may have a formal method in which to do that. If not, as a worker at that agency, you may want to do your own quality service check-ins with clients to make sure that they are happy and pleased with the services that they are receiving. Here at Howard University, we evaluate our services through um, an evaluation for your class. Toward the end of the semester, you will receive an evaluation in which you are expected to evaluate this particular course, but all your courses. And that's an example of a quality of services received. But we don't have to wait to the end of the course to see if students are pleased. Oftentimes, professors such as myself, we use evaluations from other courses to inform this course. So the experience that you're receiving as a student is being impacted by evaluations provided by students before you. So you're benefiting from the evaluations before, and the classes that come after you will benefit from the feedback and your evaluation that you provided. I've received a couple of emails from students stating that the videos are very helpful in helping them understand the knowledge and material in the course. Well, I continue to use videos and try to improve upon those videos because it was informed in prior evaluations that they were helpful for students. So I continue to use that as a teaching method. And things that don't work well, they are removed from our course. But I have to be very careful with that because what may work with one student may work very well for another student, and we'll talk more about that in terms of limits of evaluation. But that is another example. Another way that we can do evaluation is through our assignments, your discussion boards and your written assignments and your reflective papers. So I can tell by how you're answering the questions in your discussion boards. That's a way of me evaluating whether you're understanding the content. And another example of that is your use of concepts and knowledge from the course for your required textbook. That is the tool in which I am using to evaluate your knowledge of content. And so I stress the importance in this particular course to use your required textbook. It's how I'm evaluating you. It's the tool that I'm using for evaluation, understanding how you're applying those concepts. So that's one of the tools that I'm using to evaluate whether you're understanding the competencies required in the course. But I'm also using the discussion board as the medium in which you're applying that tool. And so I'm determining and through your discussion boards, for example, how you're applying the concepts from the textbook. So the textbook is a tool, and the discussion boards are tools of evaluation, and your assignments as well. It is how I know to check in with students. I'm providing comment and feedback to them based on how I'm evaluating their understanding of the course concepts. And then I may reach out specifically to a student and say, hey, let's talk about this area that needs improvement. It's me evaluating your understanding and whether you're meeting the objectives and goals of the course, and then trying to correct in real time rather than waiting to the very end of the course to realize that students need more help in a particular area, for example, and waiting for those evaluations to come back from you all about whether you understood the course content, for an example. Um, it also examines the effectiveness of the staff and the services when you're doing an evaluation. For you, think about your field internship. Many of you will be getting an evaluation called a midterm evaluation for your field. It's an evaluation of your progress based on the learning contract that you submitted. You also have a final evaluation for your field internship. And those are examples of how your effectiveness as a field intern is and how effective you are with clients and delivering services to clients. At the end of the field, you will get an evaluation of your field internship, and that'll give you the opportunity to evaluate the field placement that you're receiving. But we also evaluate the field as a faculty consultant. I also serve as a faculty consultant, and so I'm setting up appointments with field instructors to do interviews with them. They're meetings, but I'm interviewing them to see how things are going in the field. How are they performing as an instructor, as a field instructor? What type of assignments and projects do they have students working on? It's a form of an evaluation. And we're doing that early on in the process rather than waiting to the end of your field experience to see how things are going. And so I then submit an evaluation to the field office about your field placement as well. So evaluation is going on multiple levels. So you're being evaluated as a student. We are evaluating, Howard University is evaluating the field agency. You will be evaluating the field agency and your field internship experience at Howard University. And again, all these things are evaluative process to get feedback to improve upon the process. So that's an example of how evaluation occurs. Me as a faculty member, I'm being evaluated. I have to report to my sequence chair and then ultimately the dean of the university, who completes evaluations for me yearly, which is similar to your midterm and final evaluations. I have to submit a midterm evaluation for myself and a final evaluation. So evaluations are occurring at multiple levels continuously throughout a process. And those examples hopefully help illustrate that to you. Evaluations track progress with client and systems as well. And so we want to know how well someone is doing, and so that you can intervene and improve upon the progress to improve the quality of the experience that a client or client system is receiving. When I refer to client systems, I'm talking more broadly now to include families, neighborhoods, communities, programs. If you're providing services, social work or generalist social work services at the meso and the macro level as well. Evaluations, when you think about evaluations, also think about how you are identifying whether a program is meeting objectives of the program, whether that program is meeting its goals, whether that program is running and operating efficiently, smoothly, and if it's cost effective. So evaluations are also applied to programs. Policies, you can also apply an evaluation. If a policy is put in place to govern a behavior or to develop a standard in how a program is supposed to operate, you want to then make sure that that policy in place is serving the intent of the policy. And so you can actually go back and evaluate a policy is effective. You may put a policy in place to improve performance of staff members. Well, once you institute that policy, you have to then go back and evaluate whether um, um, staff members' um, output has actually improved by the policy, if that is what the intent of the policy was. So even with policies and programs, we just don't start off, we just don't end with creating the policy. We then go back to see if the policy is addressing the need in which it was meant to cover, or if you need to go back and revise it. So why is evaluation important? Based on the few areas I touched on, hopefully you're starting to get a sense on why it's important. Evaluation is important because it is a collaborative effort between the social worker and the client, looking back on progress that has been made. And so you're at one point of time, and then you're taking a retrospective. You're looking back to see how things have went. If the client is not making substantial progress, then it can be a time to reassess the goals, um, or reassess the steps that you put in place to achieve the goal. In the book talks about it by the generalist, the GIM model. Um, it may also be necessary to develop a new plan. It is not considered a setback if you have to revise the goal plan and the objectives. That is the whole point of the evaluation process. If you find that there are certain areas that are either that can't be met because of changes in the client system, or changes in you as a worker or the agency, then it's okay to revise those goals to be more successful. And again, there's plenty of methods to do that, and our textbook talks about the generalist intervention model as one way. Um, this process helps the client understand the changes they have made during their time working with the social worker. Why it is important, again, it focuses on data collection to improve service delivery. And that could be collecting data to help improve staff performance, collect data on the service tools that are used by the agency. That could be intervention tools, this could be assessment tools, surveys, groups, if that is used as a tool to improve outcomes for clients. All those things are on the table in terms of data collecting. And so you're collecting information about all the different things your agency is using, or you are collecting all types of data related to the client itself to make sure that they're progressing. So you want to know how well they're meeting their goals and objectives, how well the intervention, CBT, psychoanalysis is working with them, group therapy, how well that's working with them, and or what are you using to get these things done? Is the computer software and systems that you're working on effective, adequate, and up to date? Are the intervention tools, how well is CBT working for a client, for an example? How well is the staff member who is actually um, providing the therapeutic tool of psychoanalysis. Maybe their performance is lacking and you need to focus on that. And you're collecting data on that performance, what maybe their performance evaluations to help determine that. And again, you're looking also at the equipment that's being used. You have the tools that you need to be effective in the work, that in what objectives and goals of the agency has. And again, tools can be the area in which you're asked to work, internet access, computers, software, database, so forth. Employee handbooks, manuals, et cetera, et cetera. Understanding areas of success and needs and areas for improvement and the needs. That's the other thing why evaluation is important. You need to know what you're doing well and continue to do that, as I said, with the videos that I provide to students, for example, or what areas need to be improved and how to then improve upon those areas. And so that's important to make sure that what you're offering is the best that you can offer, or that you're continuing to improve upon whatever it is you are providing. It determines if changes are needed in the process. And those changes can occur in the who, the person, whether there's more staff members needed to do a job, or maybe if that staff member needs more training to do that job effectively. So those type of changes in the who may be required based on your evaluation. How? Maybe the intervention tool is not working. Ugh, I am so sorry about that. That was my dog barking in the background. But the how would be whether the intervention you're providing is working well. Maybe group dynamics isn't helpful. Maybe clients need one-to-one. Maybe a task group is not helpful. Maybe an educational group is necessary. So again, evaluating those processes helps you determine what type of changes are needed. When you may find that morning time doesn't work best for group meetings for your clients, that evenings work better because of their work schedule. You may find that weekends may work better, or you may determine that a lot of your um, 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 clients that are in childbearing age are not attending the group because of childcare issues. And so maybe you may decide that unless there's a childcare assistant or support component, when you're having a particular group may not work for a subset of people in that group. And where there may be changes in where the agency is located may not make it accessible to key clients that are being served by the agency. Maybe where you're working as a social worker, maybe your office space, maybe it's a shared office space and it doesn't allow for privacy to see clients, for example. Maybe there may need to be tweaks or changes in locations, where the service delivery is occurring, or where meetings are occurring, where you're doing your work to be more impactful for clients or client systems. And also, evaluation is important because it highlights if there needs to be a change in direction. And that could be directions in your goal planning and objectives with clients. Maybe you're focusing in a particular area, but you're finding that the reason why you're not being successful with that client is, instead of focusing more on mental health and the internal processes, mental health processes or challenges that are going on within your client, Maybe you may decide that the direction may be with the family. Maybe you notice that, well, maybe I'm not making the outcomes that I am with mental health is because this client is depressed because of their family systems. Things that are going on in their external environment is pushing them in terms of deteriorating their mental health. And so you may stop doing psychoanalysis, or you may decide to hold off your intervention with CBT and decide to focus your direction on the family, improving the family system and the family environment first before continuing to work with the CBT. That's another example of how you may change direction. An agency may change its direction. Maybe they're focusing on mental health, but then realizing in their work with clients that they're not making progress because there's too many underlying substance abuse issues. And so, as a direction, your agency may shift and focus on substance use first, prior to engaging in mental health. And so maybe the focus was on primarily mental health, but they're realizing we're focusing primarily on mental health without addressing the substance abuse or substance use issues. Oh my God, so sorry. I apologize for that interruption. I had somebody ring my doorbell and the dog started barking again. I apologize for the interruptions in this video. Again, why is it important to evaluate? It is uncomfortable to have your work evaluated, but that feedback is critical for improvement and improving the quality of your overall work. So that feedback can be helpful for you as a staff employee and as an intern. So similar to you, as you're doing your field, that midterm evaluation may be a little uncomfortable. Even though you are aware of the learning contract and things that you need to be completed, it's hard when somebody is evaluating your work and with a critical eye. Anytime you're told that you're not meeting the competency level or that there's still areas of growth that is needed, it's not a great place to be. But please know that it's to help you improve and be the best worker or intern that you can be. And that feedback is going to be helpful, and you're going to be able to use that when you're actually working as an employee and being paid for your work. Similar to me, evaluations are not comfortable. I have to open them up and read them, and you give your best go at it, but sometimes your best may not meet everyone's expectations, and so we all have to be open to it. But that is a limitation of evaluation. It's uncomfortable but needed. Another challenge with evaluation is that it's time consuming, okay? To the process of evaluation takes time. As you'll see as we move on to the PowerPoint, a lot of it is very similar to research actually. A lot of the terms in your required textbook, validity, reliability, independent variable, it takes time. It's a process, and all processes take time. But that time can interfere with the work that you actually have to do. So sometimes an agency is doing an evaluation of worker performance, and then they may need to interview workers. Well, you have clients that you have to see, and if you have to take an hour or two out your day to do an interview, that's 2 hours that's taken away from your time. And so, in one aspect, a challenge of evaluation is that it takes time away from your normal activities. However, if that evaluation is done properly, it may give you feedback to improve your time so that instead of having it taking you 8 hours to do your work or 7 hours, the results of the evaluation may show you where you can get your work done in 5. Or it may help with a process piece where they improve software, improve computers, improve internet speed. They may make changes to how you work. And even though it may have took you 2 hours of your day to do the interview, the information that was received by all the workers will then help you save time in your work moving forward. So think about it as, yes, it does take time, and that could be a limit. But if it's done right and the outcomes are in your favor, which that's the whole point of an evaluation, making sure that even though things may not, the data that they receive may not be good, they can then use that data to improve upon things that are going on in the agency. So it does take time, but it may also save you time in the long run by improving how your agency operates or improves how you do your work. Um, another challenge related to evaluation is that oftentimes when you work in an agency, there's more focus on progress, goals, and objectives rather than the evaluation itself. So when you start work and when you're trained, when you go through a new employee orientation or you're onboarded, there's a lot of focus on what it is you're supposed to be doing, how you're supposed to go about doing it, even your trainings, subsequent trainings that you have after you're onboarded, focus on how to do your job and how to do your job better. A lot of focus is not on how do you evaluate your job and your performance. And oftentimes, when you think about working at an agency, even your internship, even your field, you're only being evaluated at 2 points, the middle point and the end point. Oftentimes, when you're working in a um, career, you're evaluated one time. And most of the year, once a year, you get your evaluation, but the other 11 months of that year, you're focusing on the work, what you should be doing and how you should be doing it, and training on getting better on what you're doing and how you should be doing it. And again, not enough trainings and acclimating employees and staff to evaluate themselves. Social work education and training and evaluation is important at all levels, right? Oftentimes, it's very easy to think about people knowing how to do evaluation and being trained in evaluation as being leaders, managers, supervisors, directors, people who have those type of titles that require governance of a group or governance of employees, for instance. And that is true, very true. They must know how to evaluate processes. But frontline workers, direct practice workers, people who do not have leadership or responsibility for groups also need to know how to evaluate their own work. Here in this course, we're teaching you those skills that you're developing is reflective skills. You know, your mini paper one, your mini paper two. Think about problems, who helped you, how they helped. Thinking about agency, thinking about missions, thinking about objectives. How do you think back on an experience that you've had with a client, experience that you've had as yourself as a consumer? How do you think about those things? What were your feelings and your thoughts during those things? How did you evaluate the help that you gave somebody? How do you evaluate the help that you were given? Those are your evaluative tools. Those are what are your observations of those situations? What are your thoughts and feelings about them? How is what you're learning in this course informing how do you think about those situations? That is starting to help build those skills of self-evaluation and self-awareness, okay? And so every individual worker should also be back on their work or look back on a situation and be able to determine whether they were effective in that situation or whether somebody was effective for them. And so again, those skills that we're helping you develop in this course, those competency areas, will serve you and help you evaluate your performance as well. Social worker leaders need to monitor operations workflow, which is efforts of staff and employees, and the outcomes of staff work and services on services and programs. So again, everyone needs to be trained and know about evaluations and applying tools to help evaluate their work at all levels, including managers, supervisors, and directors, right? However, social work leaders, usually your supervisors, managers, and directors, they're actually charged with, meaning their expectations is to evaluate operations of an agency, which includes the workflow, who in the agency is doing what, when, how, et cetera, et cetera. They're charged with evaluating and monitoring those things, and they're also charged with evaluating outcomes. Now, there are two key areas to think about when you are thinking about the evaluation process. And one is data gathering and the evaluation process that you're going to use. Another way to think about it is your methods. So data gathering is one step, and then the methods, what method or evaluation process you're going to use. Data gathering looks very different depending on the evaluation or the method process you're going to use. So you need to determine in your when you're thinking about evaluation, you'll work with a client or work with the client system, such as a community, family, or an agency. You want to think about whether it's a program that you're evaluating will determine what data gathering tools you will be using. Will you be using a survey for your client to understand whether the services that you provided were of high quality, whether the client felt that their goals were met and you helped with that process? Whether you're going to gather data by scores, sometimes you're some of the assessments that you use. So, for instance, if you're saying that you're working with your client and the goal is to improve depression outcomes, are you going to use the depression screen and the scores from that screen to determine whether the client's depression symptoms have improved over time? Are you going to use interviews? One of the assignments will be your community assessment. And your community assessment has an interview component for your data gathering. Okay. It has other types too, but one of the key components is you're going to be interviewing a key community member, and you're going to decide what person that you're going to interview to get help gather the information that you're looking for from that community assessment. Observations are also key in that assignment for your community assessment paper. You'll be using your observations. What do you see in terms of in the neighborhood when you canvass the neighborhood in terms of grocery stores, parks, recreation, schools, churches? When you're understanding what all makes up or comprises that community, you're using your observation. What do you see in terms of socioeconomic status? Is it middle class, upper middle class? Is it poor, poverty stricken community in your observation? Is it ethnically diverse or not? Those are the observations you're using your data, you're collecting that data. So when you're evaluating something, you are determining, you're using your observations to inform. That's one of the tools that we use in data gathering or in evaluation is observations. But then you have to decide whether the data gathering tools that you're using, whether the surveys or scores, are they valid? Are they reliable? Reliable is it effect? Is it when something is reliable, does it give you the same results frequently? So do you know that when you're surveying a group of parents, that tool is reliable and that you're going to get the same level of outcome from that surveys for each person that you survey? So you want to make sure it's reliable in terms of gathering um, um, your end data being similar and reliable, that the results aren't changing necessarily. Um, it's measuring what it is you want it to measure. And the same thing with validity. When you're thinking about is something valid, is it actually measuring depression? So Edinburgh is considered a valid tool, and that the scores on it have been tested with population, so it's known to predict outcomes or screenings related to depression. So we know that if one person scores that says a certain that reports or scores a certain level, and that they're considered to be mildly um, depressed, or if it's determined that based on an Edinburgh depression screen, for an example, that somebody is not experiencing depression, we want to make sure it's valid, meaning that we want to know if one client reports a certain amount of symptoms or not, that if a similar person reports the similar symptoms, that they're going to get the same score on that screen. Okay, we want to make sure it's valid, it's actually measuring the symptoms that we want it to measure. Now the reliability is we also need to make sure that that score that that person received is similar to someone who's going to get that same score if they reported the same symptoms. So reliability is outcome of the tool. Validity is how the tool is applied. So you want to make sure that when you're applying the tool that it's measuring what you want it to measure, and then you want to make sure those outcome scores are reliable, that way you can actually use that screen for other people in similar circumstances and get the same score based on the symptoms that are reported. And so based on that, self-report is important. That's another gathering tool, a data gathering tool. We oftentimes use self-report. Think about an evaluation, your midterm evaluation. Sometimes you'll go in first and you'll fill out the evaluation based on how you felt you met the learning contract objectives. But then your supervisor will then review your self-report with you. The example that I gave you on depression screens, they're self-report. It's people saying, I feel sad. I feel like I sad most of the day, nearly every day. They are reporting a lack of interest in pleasurable things. They're reporting crying. They're reporting um, um, many things that is self-reported. So we're relying on the client or the person that's being evaluated to provide the data in which we're using to evaluate the process. We have other examples here in terms of the evaluation process itself. Please read more about it. The data gathering tools are in your textbook in the chapter for this week, and the evaluation process. So make sure you're very familiar with these terms. They are important in understanding the evaluation process. So the formative evaluations are one area that's discussed in your book, and it really focuses on the process of providing help and evaluating that process of help. And it's directed to whether the client's systems is effective in helping the client meet their goals and objectives. It's actually evaluating the effort put. Think about the social worker's role in improving client outcomes. So those formative evaluations are informing you of the process of help and how effective it is for a client. Summative evaluations are similar to the example that I gave you about the end of the year evaluations for the courses. They are not done in real time like the formative evaluations while the process is actually happening, but those summative evaluations happen at the end. And so what you'll be doing is you'll be evaluating the total course offering with those evaluations that you'll get at the end of the course. That's an example of a summative evaluation. A formative evaluation would be me determining whether you are understanding the course's content in real time as the course is progressing. It's me using the discussion boards and your assignments to inform me as a professor, evaluate whether you're understanding the content. That will be an example of a formative evaluation. And the scores that you're receiving for your assignments is your formative evaluations, your current grade point average for the course gives you an idea of your way of that's how we're evaluating how you're doing in the course at this particular time. And that current GPA is based on the grades that you're getting for your discussion boards, mini paper one, mini paper two, for example. Those are your formative evaluations for the course. When you think about baseline, it's a measure of frequency, intensity, or duration of a behavior, and it is done prior to an intervention. So in terms of a baseline, an example here would have been instead of giving you the syllabus quiz, if I gave you a social work practice and process um, um, pre-course quiz where I asked you 50 questions because I'm trying to get a baseline. I'm trying to understand what you know about social work practice and process from a generalist perspective. And that will be my baseline score to see how you do. So let's say many of you all take the course and all of you take the quiz and you don't do well. Of course, that will be expected because you didn't know the content before you started the course. But now I'm looking at those areas and seeing where you scored your baseline scores, and that's giving me information on, okay, these are the areas that I need to focus on a lot because they don't know it. So, and an example for somebody who's depressed, or if they come to see a therapist and say, hey, I feel depressed, I don't know what's going on. Well, I'm going to do a baseline to determine what level of depression are they. Are they mildly depressed, moderately, or severely? So I may do a pretest, a screen, a Edinburgh screen for a pregnant mom, there for perinatal. Um, they have the Beck depression screen, which is your general depression screen for all other people, but Edinburgh is specifically for pregnant women. But I may want to see if a pregnant woman is depressed before I engage in psychotherapy with her. So I will do a Edinburgh depression screen, and she may score like an 11 or a 10, 11 or 12, which is considered a low score on that screen. And so a low score for depression. It could be lower and says that she has no depression, which would be a 10 and below. But let's say she's definitely depressed, but it's low, so she's scoring around 11. And so then what I would like to do is I would like to then give her sessions because her baseline score is 11. That was the first one that I did when she first came. And then I would say, okay, she's mild. Then what I would do is I would do a subsequent depression screen after she's had several sessions with me. And if I felt that her objectives and her goals of the treatment plan I put in place was met for her depression, then I would go back and score her again and then compare her final score with her baseline score. What I want to see is a score that's below 11 to know that she's improved or she's improving based on the baseline scores. And in reverse, somebody you can screen somebody and they can be severely depressed, but then you at baseline and then you want to score them again, a post-test score, and then see that they're under the severity. You want to see whether they're at least moderate or mildly depressed or not depressed at all. So that baseline gives you your prior score in which you're going to evaluate your progress on at a later date. I'm not going to go into the rest of these um, terms in detail, but please make sure that you are aware of it. We did talk about reliability earlier on in this review. We talked about generalizability. Make sure that you read in depthly in your textbook. Independent variable versus dependent variable. It's used in evaluation. It's also used in research. You'll cover research more as you move along the course sequences um, for Howard. Single subject design, goal attainment scaling, task achievement scaling, and target problem scaling. Those are all evaluation processes. Make sure you know that, refer to those in the book, and that you're familiar with them. When you think about scaling, it's just a method of plotting and targeting progress over a course of time when we think of a scale. We have different types of tools that we use to scale. Think about scaling in terms of a Likert scale, for an example, where you've ever filled out a survey where it says, um, professor was effective, um, excellent, good, moderate, score, poor, really poor. That's a scale, for an example. Um, and you may also want to think about a Likert scale is one where it gives you a range. Another similar scale that we've used here in this course is think about your course rubric. That's a scale of progress. Student above competency, um, or competent, um, no, developing competence, no competence. That's another example of a scale. Okay. And so goal attainment, task achievement, target, problem, when you think about scaling, is these tools that they're used to measure intensity, frequency, improvement. So you from a low to extreme. And so how a variable that you're measuring is scaled. Um, and you see that oftentimes in your rubric. So the only difference here is there's a scale for goal attainment. You're using a scale to measure goal attainment, a scale to measure task achievement, and or a scale for target probleming. So how are you scaling these things? And again, a Likert scale is one example of that. Your rubric you may want to use as another example to identify goal attainment. Again, independent variable and dependent variable, read a little bit more about that in your book. Um, it provides more information as well as examples of evaluating through independent and dependent variables. Evaluations occur at every level, micro, meso, and macro. And this slide provides you an example with that. When you're working with a client, reading over his or her initial goals of leaving his abusive boyfriend in a domestic violence situation and getting his own apartment. You review how he met his goal of leaving his ex-boyfriend, saving money, and obtaining an apartment, and how he has reported being more confident and happier, and maybe even safer. Will be an example of how you are evaluating a process from a micro level. Meso level, a community created a community garden. The community and social work come together to discuss how they made the goal, how they worked together to make the garden, and how it benefited the community. Macro, after a year of a new policy being passed, a social worker discussed the effects with policymakers. You analyze the progress or lack of progress being made. Due to a lack of progress, the committee decides if they should change the desired outcome or the policy. That's an example of an a brief, simple explanation and summary of evaluation process at the micro, meso, and the macro level. This is an exercise micro level for a young man. Today you are meeting with your 21-year-old client Brody. You have been working together and crafted a plan for him to stop smoking. He finished all the steps in the plan and you both sit down for evaluation. He says he is still smoking and the plan to slowly cut back on cigarettes is not working. Once he smokes one, he has the desire to keep smoking more and cannot stop. As a social worker, how would the rest of your evaluation go? What are the next steps? What are some specific things you would say to Brody? And I strongly recommend here, think about the different data gathering tools that you would use, um, whether you would use a survey, interview, self-report. Well, how would you gather data to evaluate what to do next, right? And how would you evaluate what to do to improve his outcomes for smoking? Also, think about the evaluation process that we talked about, and what you may use that you think might be helpful in terms of the process to support him. Would you use formative evaluation, a summative evaluation? What baseline would you need to collect for him? How would you how what tools would you use, and are those tools to measure progress, and are they valid and reliable, for example? So think about that. And also, I want to touch here on macro level evaluations, so that we're, clear for, especially for those students who may focus on CAP or may have some CAP community administration and planning activities in their field. Evaluations and macro level evaluations and designs look a little bit different, but some of the same concepts can be applied. But you're doing more a needs assessment of a program, of a community, of an agency. Um, you are doing evaluating evaluability assessments, okay, where you're evaluating the ability of that agency to meet its missions and goals. Process analysis. You're looking at the formal processes that are in place in the programs, service delivery lines. You're looking at staff members, their capacity, their education, training, and getting the outcomes complete for the agency. You're doing program outcome analysis. You're wanting to see if the program is doing what it's saying it set out to do, right? Validity of that program. Is it actually doing what it says it's going to do? Quality assurance, how they're going about their work, their process, their service delivery, and our clients and consumers happy and satisfied with the services that they're receiving. You may also be doing quality assurance with staff members, making sure that they're happy with um, um, job satisfaction. Do they have the tools that they need? Are they supported the way they need to be with leadership? That type of quality. So you want quality from the staff level. Staff are happy that they with their jobs, the location, the environment, the training, the support, the pay, the benefits. Those type of quality assurance programs, again, can be quality for the consumers or the staff members. And program monitoring, ongoing assessments of the program and how well it's meeting its goals and objectives, and ongoing monitoring to make sure clients are satisfied and happy that with the services that they're receiving, they're meeting their goals and objectives, as well as the agency meeting the goals and objectives. And this diagram provides a visual for that. Evaluation of goals includes clarifying program objectives, because you may find that workers are not clear on the objectives, and so their work is not meeting the needs of the agency because they're not clear what those objectives are for the program. Assessing program appropriateness and effectiveness, that's that ongoing program monitoring and process analysis that's going on all the time. Advocate for your efforts. That would fall in quality assurance for maybe staff or clients. Solidify support for financial investments. That will go under program monitoring. Making sure that, financially speaking, you have what you need, you're meeting funders' objectives for the program, and that you're financially sound as a organization or agency. Um, that may be related to outcomes, program outcomes. That may also be an area that you're evaluating in terms of your assessments for the program, the financial piece for that program. Do you have what you need to deliver the services? Do you have enough staff members, and or do you need to hire more, and do you need more money for that? Do you need a bigger building? Do you need more tools to do um, your work? And so understanding how finances play in that is key in the evaluation of the program. And addressing the cost. Is the revenue that you're receiving from the program enough to meet the cost of the program? Again, that may be an area for needs assessment. Do we need more money to sustain this program? Um, Making program improvements, again, falls in the line of could be financial if it costs money, but it may be improving the programs to meet the needs of the workers, quality assurance, the client's quality assurance. And hopefully your program outcome analysis will let you know if those program improvements are indeed needed. Remember, there are limits to all evaluations. No evaluation is perfect, but you want it to do a good enough job to be able to give you feedback to improve upon the work that you're doing. Data may apply to a subset of individuals, but not representative of all, and that may be an issue with generalizability, meaning you may get surveys from a sample population of clients that say services are great, but you have to realize, you may evaluate, your evaluation may be good from that sample that, oh, we're doing a great job. Well, you have to be mindful that that may not be generalizability to the experience of all clients, because that was a sample set that was helpful in gathering that data to know that you're doing things great. But you also have to realize that there may have been consumers that weren't sampled that had horrible experiences with your client, with your agency. Using appropriate evaluation tools, issues of validity. So, for instance, I identified earlier there are two types of depression screens. There's the BEC, which is a general depression screen, and there's Edinburgh, which is for pregnant and postpartum women, or perinatal depression. Um, you may realize that some of your workers have been using the Edinburgh to score depression rather than BEC, and you're not working with clients who are pregnant or postpartum. And so that may be an issue of validity. Are we measuring what we're supposed to be measuring? Yes, it's measuring depression, but Edinburgh is for a certain population. It measures depression for pregnant and postpartum women. And you found out that a few social workers are using Edinburghs for your population in your agency for all of them, and all of your clients are not pregnant or postpartum. And so the tool is not accurate. So they should be using the back. And so that may be an issue of validity. So you may get a result saying that you're doing great in terms of improving depression, but find out that the tool that is being used, there's a problem with it. Evaluation tools are as good as the user. You must train people on tools that they're using for assessment and intervention and or evaluation. So you may find that the results that you get is not the actual results. It may be errors in those results based on who is the person doing the evaluating, or who's the person providing the intervention. Okay. Consumer feedback in the process. Oftentimes we evaluate and don't give people who are being evaluated a say so in how we evaluate. And so think about this as um, an advisory board. So, for instance, think of a hospital who wants to improve patient satisfaction. They want to improve the patient experience, and they develop a tool to evaluate patient experience, but they forget to talk to patients about that tool. So they may say, hey, a happy patient is one that's pain free. A happy patient is one that has the best care provider. So we're going to create a survey that's going to make sure that in the survey we ask questions where patients can score how their pain was attended to while they were in the hospital. And on that survey instrument, we're going to have them rate the doctors and the nurses and the social workers. And that's a good way of finding whether patients are satisfied with our service. So the administration of the hospital decides to move forward with that, but they forget to add the opinion or the feedback of actual patients when they try to come up with a survey to measure patient satisfaction. And so they find out after doing their survey that they get all these great response, and they feel that their tool was effective in measuring what it is they wanted to measure, right? It's a great quality instrument. It's used great. We get great results. And then come to find out, they start getting reports that patients aren't happy. They call, the patients are writing letters to the president of the hospital, the CEO of the hospital, saying they're not happy with their experience and so forth. And then when they go and do a more careful analysis, they realize that patients were complaining about the cost of parking. They were complaining that their family members weren't able to visit them while they were in the hospital. They may complain that the hospital rooms were clean. They acquired infections while in the hospital. None of those areas were added on the tool, on the patient satisfaction tool. And they made the mistake of not including patients in the evaluation process or in the evaluation tool. So when they went to create the tool, they they decided what they thought patient satisfaction is instead of going to the consumer and saying, what does patient satisfaction mean to you? And making sure that they were measuring what patients felt were important in terms of quality. So that's an issue. Evaluation process interferes with operations. We talked about that. It's hard to evaluate while you're actually performing the normal duties of an agency. And in terms of time, it's a disruption to staff and so forth. And so you have to think about that though when you think about your evaluation process. What process can we use that can give us that's a high quality instrument that's going to give us the information that we need to make improvements, but does minimum interference to how we operate every day. Alternate reasons for program outcomes or varying outcomes with uniform interventions, the issues of equifinality and multifinality. And so this, in brief, the quickest way to explain this is that equifinality is when uh, you have the same output. So the outcomes are the same, even though you use different means to get to that outcome, right? So you can have the same outcome when workers are providing different interventions, okay? The other concept is multifinality, where you have the same outcome or different outcomes from different inputs. Or more clearly stated, you may have workers that are providing different interventions. Um, same intervention for social workers, but they have the same different outcomes. So that may be a social worker. You have two social workers in an agency. One is providing cognitive behavioral therapy, one is providing attachment based therapy. You have two different interventions being used, right? Um, for a particular client. So you have two sets of workers. You have workers providing attachment based therapy, and you have workers providing um, cognitive behavioral therapy. Let's focus on the ones that are providing cognitive behavioral therapy. They are consistently providing cognitive behavioral therapy with 5 clients. And of those 5 clients, they're getting different outcomes in terms of progress for that client. So that's the different end results. So you're getting different end results, though that particular group of social workers are all using attachment based therapy or cognitive behavioral therapy. So think about you're evaluating a program, you have groups of social workers using different interventions. So the ones that are using attachment based therapy, they're all using attachment based therapy, but the client outcomes are different. Some are progressing, some are not progressing, right? Then you have someone who's using a group of social workers who are using cognitive behavioral therapy, and they have difference in outcomes as well with their clients. Some are progressing and some are not progressing. That is the concept of multifinality. Same interventions, different outcomes. Now, using that same example with equifinality, when you think of equifinality, think about social workers in an agency using attachment based therapy, right? And they're using cognitive behavioral therapy, and they're evaluating the outcome, and they're noticing that all the clients are progressing well, right? So they evaluate and they know that the clients are progressing and meeting their goals with both those two interventions, okay? So that's showing that the same outcome is being reached by using two different means, right? Different means. That is equifinality, getting the same outcome with different interventions. And so think about that. So when you're evaluating the program and these issues of equifinality and multifinality show itself, sometimes it's hard to determine what is improving the outcome, right? For equifinality? Well, is attachment based the better modality, or is cognitive behavioral therapy? We won't know because the outcomes are great. That's a good place to be, but it's hard to decide which one to train more on, or maybe we're training on both. It's hard to decide which one is the better of the technique for your agency because they're both providing the same outcomes, right? Now, the other problem is with multifinality where you have different outcomes with clients, but everyone is using the same therapy model like cognitive behavioral therapy, right? It's hard to tell what's the problem here. Is it the intervention? Because you have some clients that are doing well, but then there's some clients that are doing poor, right? So it may or may not be the intervention itself because you got some clients doing well with, multifinality, but then maybe it's the person delivering the cognitive behavioral therapy. Maybe it's the actual therapist that's the problem. But it's hard to tell because again, you have clients who are doing well and clients that are not doing well. So you have to be realize that these concepts play a role in evaluation. You have to know what it is when you see it come to play, and just know that things are getting a little bit more trickier and that you may have to tease out some more information to really help with your evaluation process. For time, as this video is over an hour now, what is termination? Termination is when the goals have been met. The ending of service follows if there are no further needed services or other concerns to address. Sometimes terminations happens before goal completion due to um, unforeseen issues such as hospitalizations, relocation, losing contact with the client, financial hardship, or the inability to engage the client. Why is it important? Termination is a vital step to the social work process and ensures that the client social work relationship is properly ended. It also can help solidify the gains made during the helping process. It empowers clients to integrate what they have learned into their daily lives and encourages them to face their next chapter of life with confidence. Termination is also useful in modeling healthy boundaries and a healthy, appropriate way to end relationships. Terminations at the micro, meso, and macro level. Micro, you and a client have completed all work needed to be done. You praise them for their efforts and positive change. Remind them of resources, encourage them to keep progressing, and you document that termination. A meso, a community garden is fully functioning and the community is no longer in need. The social worker encourages the community to continue working together and review the progress made. On the macro level, after the policy is passed, the school social worker applauds the policymakers for their work to create better school systems and encourage them to keep the people's needs at the center of the policy. Then they leave the committee since their work is done and return to the school district. Termination task. Okay. This picture shows a faculty member getting the boot termination, right? But in social work, we do not look at termination this way. We look at termination not as an adverse um, punitive process. Um, but we do recognize it as part of a larger process, and it refers to the ending phase of our work with clients. And instead of it being this harsh, abrupt, adverse activity such as this boop, this is a collaborative effort that's even discussed at the very beginning when you're contracting with your client. They know the capacity of your services, how long the services are going to be, and then when the time comes, it's not this kick in the butt for clients. This is not what it looks like for us as social workers in generalist practice. We're deciding the appropriate time to end, and this is an agreement with the client done at the start of services. It's an evaluation of achievement of objectives and goals. It's a positive process for us. This is where we say you've met your goals, you met your challenges, or you've not. Let me support you with that. Or let's go back and revise them to help get you where you need. Positive process. It reviews the services provided by the agency, talks about all the support that was provided for the client or all the interventions so that the client knows what works for them in the future. And it's a plan to maintain and continue that progress. Again, strength-based positive outlook. And so we talk about where they've come, where they are at today, and how they can continue those gains in the future. There's also time to resolve emotions, feelings, and thoughts. So instead of just booting somebody out the door, if they're upset about the termination process, you discuss that with them. You help them adjust and cope with the time, with the end period, knowing that they have the skill set to be okay and to continue to progress. If they're sad about that, again, these are things that you talk about during the termination process, and their thoughts about terminating. They may be afraid, they may be worried, they may think that they can't maintain and progress. It's an opportunity for us to continue to support clients. Sometimes they may need a referral depending on what they say about their emotions, feelings, and thoughts. That doesn't necessarily mean that you as a social worker can continue to provide services if the goals that you've set are complete. Maybe the client has ongoing things that they need to address, and then a referral may be needed. Sometimes they just need to feel confident by you as a social worker that it is time, and sometimes reviewing that the goals have been achieved, let them see that they're ready to move forward. Um, Sometimes it's determining follow up, right? Whether you need to follow up with that client in a month, 2 months, or maybe follow up with the referral source to make sure that that connection was made and that soft handoff was made for that client. But most importantly, the determination process is a summary. It's a summary, it's a historic narrative summary of your work together, goals that's been achieved, and a boost to that client in terms of you're cheerleading them on, knowing that they can move forward with their life, with the skills, and through meeting the goals that they need. And it's also a pep talk to let them know that they can be successful moving forward. How would you terminate with a client who um, tells you that that this is their last session because they do not think therapy is working? If they feel that therapy is not working for them and they want to terminate, um, how would you terminate with a client? A client you have made a strong professional connection with and that you've been working with for 3 years to help quell their anxieties. Been working with them for 3 years, you have a strong connection with them, and it's time to terminate. Okay. How would that look for somebody you've been working with for a long time? A child you have been working with for 7 months that you must terminate with because you are relocating. What does termination look like in that instance? Again, think about the task of termination that was discussed in the prior slide and what you would do. Name specific actions and statements you would use. This is a good exercise to understand what a termination should look like and what are some of the task skills associated with that. Again, what is follow-up? Follow-up is when the social worker reaches out to the client to make sure they're keeping up with the goals attainment using their skills and making sure the client is doing well overall. It's your check-in with the client after termination. The follow-up may not always be possible due to different situations such as death, relocation, and change in contact information, just to name a few. But even then, you still document that an attempt at follow-up did occur. Follow-up is important to continue to encourage clients. Let them know they are still supported, remind them of resources and goals, maybe use of referrals, reminding them to use the referrals that you put in place for them, and make sure they are still using the techniques that you found to be successful for them to meeting their objectives and goals. Follow-up can be beneficial to the morale of social workers as well. Social workers can learn if certain interventions are successful post intervention and post your work with them, and can use information for statistical purposes, and it's part of the data gathering for your evaluation when you have good follow-up with your clients as well. Follow-up at every level, micro, meso, macro. A social worker makes a follow-up call with a client after 2 years. The client still has independence and met a new man. However, he noticed some red flags and remembered the skills taught in sessions and broke off the relationship before it could become toxic or abusive. That is what you learn in following up with a client on a micro level, for an example. That means they're still utilizing the skills, they're aware, and they know what to do. Meso, the social worker revisits a community garden after 5 years and sees that some of the community youth are now community leaders. The garden is thriving, the community has maintained their goals in the process to achieve them. Um, Follow up on the macro level. A social worker returns to reconvene to a reconvening of the committee that passed the policy 10 years ago. The new policy is working well in the community and has created better school outcomes for the state. Exercise. You check up with a client a year after termination. You find out the client is back on meth and homeless. After she got out of rehab, she was doing great. She got a job and even had a queen studio apartment she shared with one roommate. But her roommate invited a friend over who brought weed, marijuana. She smoked with them since she considered weed to be a minor drug. The next day, she was drug tested randomly at work and lost her job. She reports that her life spiraled out of control after these events. As a social worker, what are you going to do? So you check up. This is a follow up with a client that you terminated with, and then you find out this is going on. What is needed here? Think about the areas that we discussed in this PowerPoint in terms of when termination is expected, how it occurs, what are the duties of the client. Think about some of the things we talked about in terms of ethics and responsibilities, social work code of ethics. How would that drive your next steps with this client? How is this an evaluation? Can this be considered an evaluation? And if this is an evaluation of how the client is doing post follow up, then what do you do with this new information that you've gathered from the self report from this client about the process? Think about that. These are some of the things that, as social workers in the field, you will encounter, and your answer to this exercise will help you understand the importance of evaluation, terminations, and follow up, but also understanding your role as a social worker in this process. Thank you.